To this story now, heart-related deaths among people in their 30s are strikingly high. Discovery Health has seen a 200% increase in cardio-related death claims over the past year. The company says deaths due to cardiometabolic and cancer-related conditions are alarmingly high. Health experts say these could be impacts of the COVID-19 pandemic. Cardiologist and president of the SA Heart Association, Professor Eric Klug, joins us now to unpack this further. Professor, thank you very much for your time this morning. I mean, this reported spike in deaths caused by heart and nervous system disorders is honestly very worrying, because we've been seeing reports that individuals who have had COVID are at an increased risk of cardiovascular disease spanning several categories. Could this in fact be linked to the COVID?
It does appear that COVID, certainly within the first year of the infection, that your risk for diabetes, whether it's type 1 diabetes or type 2 diabetes, and a broad range of cardiovascular disease, from rhythm problems to muscle of the heart problems to clots to the lung, that's all increased within the first year following the infection.
So meaning it should subside 12 months after?
It should, depending on reinfection, depending on how the community takes up the vaccination booster proposals, because it has been found that patients who were boosted or had been vaccinated have a much lower incidence of cardiovascular and diabetic complications, and certainly survive the initial infection with less sequelae than the patients who were not vaccinated.
So COVID is honestly very brutal. As many doctors have said, it really does destroy your system inside. But beyond this, are you exclusively saying that COVID, or these numbers can be attributed to COVID, or there has been some sort of a lifestyle shift insofar as the food we eat, the amount of exercise that we're getting in? Could there be other reasons why we're seeing an increase in cardiovascular problems?
That's an excellent point, and it talks to the problem that during COVID and even following COVID, there's been a problem of health accessibility. I think in the public health arena, it's been more of a problem of the public health areas closing certain clinics, certain wards, and patients not being able to attend their usual hospital and sent to district hospitals or clinics to get their medication. And in the private health sector, it's been more an issue of patients not attending their usual visits, and therefore their management of hypertension, of cholesterol issues, and also they've found that a diminished exercise program related to COVID has impacted probably on this increased incidence of cardiovascular disease. But that's notwithstanding that the virus itself causes microvascular disease. It affects the small vessels, it increases the clotting profile, and so its own impact is certainly important, as well as the sort of immune response that people have to the acute infection.
So how do we assist the healing process post-COVID? Because, you know, there's Dr. Google. So many people would try to either diagnose themselves and then also heal themselves in the process, where we've often heard that try to be as active as possible when you start beyond COVID. But then others say, no, don't strain your heart, don't move too quickly, you've got to take it easy. So which one is it?
I think it's important that in general, although we say the percentage increases, the relative risk, when we talk about relative risk, it sounds alarming. So you can say, okay, the relative risk of death in people under the age of 39 increased by 134%. But that's coming from comparing to their peer group where the incidence of death is very low. So it actually only increases by 4 deaths per 1,000 infections. So when we look at these relative risks, we must maintain our perspective on the actual number of cases that you see. So by far the majority of patients who have COVID can re-emerge and do an exercise program. I think the importance of these results is that, one, doctors must recognize that COVID is associated with more diabetes and a possibility of more cardiovascular disease. So when they see patients complaining of issues, they should entertain that possibility, as well as patients, if they, or people out there in the public, if they feel they have symptoms of whether it's diabetes or cardiovascular disease, that they seek professional help and they don't just place it on, oh, well, I've got fatigue related to long COVID. Let that fatigue be a diagnosis of exclusion after you've attended a medical professional to ascertain that.
I'm glad you actually mentioned long COVID, because a number of people that we've interacted with, a number of them would say that, I'm in my 30s, but now it's so difficult to go up a flight of stairs. I would just be breathing so heavily by the time I get there, but these people are not necessarily unfit. But beyond COVID, they've had these symptoms, but they haven't gone to the doctor post the COVID to rule out any other disease.
I agree with that completely, what you're saying there, and that underlines that very important message that I think we must give to the public, that if they're having a significant reduction in their ability to perform tasks, whether it's daily tasks in the house, getting dressed, bathing, climbing the stairs in their house, or catching the taxi or walking to their work, then they should see or attend a doctor or nurse and have that investigated before the diagnosis is made of, okay, and there is certainly fatigue, post-viral fatigue syndrome, which is well recognized, and that just needs time to get better. So you want to exclude these underlying possibilities. So if somebody's fatigued, drinking lots of water, passing lots of urine, and has lost a bit of weight, then you'd think, well, there's a possibility of diabetes. So whether it's young or old, and the other important message is that no matter how severe your initial infection was, so obviously people who were admitted to hospital or were admitted to ICU and survived that, their incidence of relative risk for these conditions that we're talking about is higher than the person who just got COVID and stayed at home. But the person who just got COVID and stayed at home and was managed at home is also at increased risk for diabetes and cardiovascular disease. So we mustn't feel sort of relatively assured that we had mild COVID and therefore we're not at risk for these issues.
And how much of an impact does one's mental well-being have on their risk, or how big a risk is it for one to have cardiovascular disease if their mental well-being is not particularly well taken care of? Doctor, we don't seem to hear you. I don't know if perhaps you've muted yourself accidentally.
No, can you hear me now?
I can hear you now. Yes, you were still saying, Doctor?
Yeah, I was just saying, it's a very important point. Mental, and I think I got the gist of what you were saying about mental stability, mental stress, and stress plays a role in possibly this concomitant increase in diabetic risk and cardiovascular disease risk. We can't exclude the risk that places on the body of stress.